All right, today we are performing a smooth threads procedure on a patient who is looking for skin tightening in this area. She initially came in inquiring about Kybella, and when I assessed her tissue, this is what I pinch. Kybella's sort of motto is if you can pinch an inch, then it's an appropriate area to treat, and unfortunately this doesn't really look like an inch to me. It doesn't even feel like fat, it just sort of feels like some skin laxity. And so we decided to try a round of smooth threads. I am going to be using the 29 gauge by 40 millimeter VSoft lift twisted thread. The twisted threads stimulate more collagen than your mono thread, as it creates a little bit more tissue injury upon placement, and therefore will stimulate more fibroblast activity and in turn create more collagen. And so we're hoping to see some nice results. The important consideration with smooth threads is that the patient is aware that this is a very gradual process. Collagen does take time to form. And so if this were a patient who is looking for sort of like overnight results, this would not be the treatment for them. The peak collagen time frame is about 3 to 6 months. And usually we do monthly treatments for about 3 months. And then you can go ahead and give them a break and allow that neocollagenesis just to sort of take over, and then see them back after that 3-month break and reassess. Do we need to start another round, or are we happy with the results that we achieved? In theory, you could literally do smooth threads every month until the end of time. There's no contraindication. It's just if she's going to form collagen, that 3 to 6 months is going to be it. And so I prefer to give them a bit of a break and sort of see what it's going to do. So you can see here, I've got her in a bit of a sunset pattern. I'm just trying to sort of fit as many smooth threads as I can in this particular area. We will stimulate collagen about 1.5 millimeters up from where the thread is placed. And so you want to make sure that they're placed relatively close together so that way you get nice, even collagen formation to tighten the tissue. So that collagen and elastin that we produce with smooth threads will help tighten tissue. You can also use it in areas on the face for fine lines and wrinkles, volume loss, acne, scarring. There's so many different indications for PDO smooth threads. This happens to be a very popular area. We did numb her for about 10 minutes with a topical anesthesia prior to starting, and you can see she's doing quite well tolerating the procedure. I would describe it as you sort of feel that initial poke of the thread, and then typically if you're in the proper plane, it should glide fairly easily. It's very important that you have appropriate training prior to initiating these or bringing these into your practice, because your depth in your plane is going to be the most important factor. We are in the subdermal plane for the purpose of smooth threads. Of course, we teach PDO smooth threads at the AAFE both virtually and in a hands-on course. This anterior part of the neck can be a little bit tricky because the neck curves. And you want to make sure that you're not going to get too superficial as you come around the curvature of the neck. So you could see she did wince a little bit. I'm going to go ahead and remove these threads, and then I have 5 more to place, but these ones are going to be in my way a little bit. And so I want to remove them so that I can get better access. So you noticed I twisted the hubs of all of these cannulas. That is how the thread engages into the tissue. So I typically prefer to twist all of them prior to removal, rather than twisting one at a time. You doing okay? Mm-hmm. Okay. All right, so we just have 5 left. Again, I'm really trying to get some pretty nice results here. I think she has the potential to get really nice results given the quality of her skin and this double chin that she came in complaining of. Of course, in the patient's eyes, it's always quite terrible, but once as injectors we look at it, oftentimes it's we're always our worst critic. And so I think that she has the potential to really improve with this treatment because this little pocket of tissue is quite small. So we ended up doing 20 threads in this particular area. Doing a little bit of cross hatching here so that, again, we can just stimulate more collagen. One more. They're all done. And then I usually just use a makeup wipe to sort of wipe off all my markings, followed by an alcohol wipe. You'll be able to see these like little injection points. Those will be gone in about an hour. And then we will see her next month in about 4 weeks to repeat for treatment number 2. And then another 4 weeks after that for her final treatment before we give her a little bit of a break. That's all we've got. Thanks so much for watching.